Ellen Langan this morning brought an amazing mindset concept, which is such an interesting way to start today. She's posed the idea that 1 plus 1 wasn't actually two. Because if you think about 1 plus 1 raindrop and they go together, you still have one raindrop. So it challenges that what we think, is it really true? She also goes on to say about medical facts are based on research. And we think of that in absolutes and they're presented as an absolute. And we don't always pay attention that there might be something different, or as people, we're all different. And therefore, maybe one idea and one diagnosis isn't exactly what we are and what we need. So it's about paying attention to different kinds of attention, more mindfulness to what's really going on for us and where we can take that into the future. Taking action is about wanting something different and taking a step towards that change by doing, thinking, or feeling differently, even if it's uncomfortable, stepping into the unknown. By changing our mindset, we change our story and we can change our life. Today, we are joined by Zac Laraman, an osteopath in North Wales, who's got some great insights about taking action after we gain a diagnosis from the doctor. Welcome, Zac. Thank you so much for joining me today.
Thank you for having me.
Would you just start with your history and where you come from and the work that you do?
Okay. Well, I've been doing this now, hands-on therapy for the past nearly 30 years now. And I've been treating patients ever since in North Wales. And I've also worked abroad in France and in Monaco and in Singapore for a while. And then traveled around the world a little bit as well, traveling and treating patients at the same time, or people. And I keep gravitating back to North Wales. So yes, and I do that every day pretty much. I work 7 days a week as and when people require. And I see the whole gamut of people from 7 years old up to sort of 92, still plugging away at the world. Um, and my philosophy of how I treat is treat the person, not the condition. Um, Treat them as a whole, treat them as a sentient being, obviously, because people are thinking about their issues all the time, and when they go and see the doctor is treating them for a condition rather than for really the person that they are. And I spend a lot of time when I'm taking a history from someone, getting to know them and getting to know what they want to do, what they're doing now, how they're feeling about their condition now, but also how they're feeling about their life right now. It's the same with the person and their condition. There's a whole gamut of different factors in their life that go to form that person, and they're not just a chronic disease or a injury. They're a person who happens to have this going on in their body at that time.
Yeah, I think it's that idea where we've got to think about it as more complex than the linear thinking of we're just going to look at this or we're just going to look at that. Because very rarely anything in life isn't just one thing without it being affected by multiple different aspects of environment, just like a flower. It's not that, let's just focus on water. No, there's lots of things that go in to help a flower thrive.
Absolutely. Well, the problem with the allopathic medical model, which is basically our hospitals, our doctors, our GPs, our sort of specialists in different areas, is it's a very reductionist, but they don't seem to talk to one another because that's where the sort of failings come in. So that I'll see people with a multitude of issues. I'll see someone perhaps with a thyroid problem, but or diabetic, who has also got a muscle tear, and that underlying condition affects the way that their muscle tear recovers, and it also affects the person psychologically. So sometimes I'll say, okay, perhaps we need to look at your diet, and I'll maybe refer to someone who's got a bit more knowledge in dietary requirements. Plus, I might say to them, like, you might need to see a psychotherapist as well to help you work through these issues that you're getting anxiety because of it.
Which is great. if that person then also looks at them as a whole and it's like an integrative idea and system, but where it falls down is if the person puts that idea and that ownership to the professional. And I think there's something here around, although we're not the experts, we are the project managers of ourselves. One, we know ourselves the best, but also we're the ones that are going to get all the different information, and it's down to us to create this file, either mentally or physically, to be able to share that so that we can gain this all round approach for us.
That's a tough thing though, isn't it? That you have to be open to looking at yourself, and a lot of people um, that I've encountered think that they're not intelligent enough to understand what's going on in their body, and that's perpetuated by. So I'm an osteopath. There are osteopaths, chiropractors, physiotherapists, doctors. Um, that was perpetuated by all of those specialisms because they come across as saying, you know, I've done this, therefore I'm the professional in this. You listen to me and do what I say. Um, Whereas we need to listen to the people in front of us and go, okay, I need to educate you and explain to you so you understand what's going on in your body so that you can do something about it yourself. Because I'm not going to be here 24/7. You're coming to see me maybe once a week for an hour. I can only do a certain amount, but people have been conditioned by our society to say, I need to go and see this specialist, or I need to see this thing. And that's convenient for society, but it's not that useful for people.
Yeah. And knowing where to go and what next, and taking the ownership on themselves. How do you find that that impacts people taking action and empowering themselves to do once they have a diagnosis, once they've come to see you? Because I know there's mindsets around, I've come here, you're going to fix me. Fantastic. And then you don't fix me because, as you say, it's seeing you for an hour once a week or whatever the requirement is for what you can support them with. So, what have you noticed with that action after diagnosis?
Yes, they are in the mindset of you're going to fix me, but I have to explain to them that I'm not going to fix them because I'm not, the Messiah. That's a hard part for them to understand, and I have to keep reiterating that to them. The human body can get better overnight. I could treat someone who's got quite a complex condition, and then the next time I see them, say, "Wow," they'll say, "It's completely gone. It's amazing." And I'm thinking, "Why has that happened?" Because not in normal terms, it would take weeks. Sometimes it just happens that they get better straight away, and they're thinking, "Well, did I get the diagnosis wrong there, or were they at a different stage that they said they were at?" Or you don't know. But at other times,
You have a secret magic wand and you didn't know it.
they say you've got magic hands, and you're like, "Well, I haven't got magic hands. You were just that further along on your healing process, and I sort of chivied it up a little bit, maybe, or you just did it. It happened. It just happened to happen after I treated you."
My experience is when I've ever struggled with physical symptoms, is there's this period of grief about it. This has affected my lifestyle. I've been really active at doing, and suddenly I have a diagnosis like my left knee. I can't continue doing sport at a high level like I used to. I can't continue doing CrossFit and, one of the fittest females in the Air Force. And now I can't do like I used to, what I see exercise. And so there is this definite grieving period where I went to different specialists and I just wanted them to fix me because I didn't want to accept the diagnosis. And then I've noticed, which I got quite excited about when I was thinking about our conversation, and I thought, I feel like this is a bit of a three-step model here I came up with the grieve, like I mentioned, and then you go into this period of believe, and then you go into the period of achieve and taking action. And this period of believe, which I think links with what you're saying, is they just suddenly got better. The power of the mindset and knowing our capability to be able to do. So that self-efficacy, that I have the capability to act and I can do this. And where people, I think, fall down is we keep trying to think the way that we've always thought. And the problem is we can't keep doing what we did. We need to adjust and change. And it's that process, I guess, that helps people along. So I'm wondering with that patient, whether we got to whatever happened in the room, one, you did help physically, but also mentally around that belief of this is really going to help, that expectation effect.
Yeah, absolutely. That often happens. Um, wh- the the thing with osteopaths and chiropractors is they do manipulations on the joints, or around the joints, and as a side effect of that manipulation, you get a little audible pop or a crack. Yeah, and you've heard of that before. They go, "Oh yeah, I'm going to get my neck cracked or my back cracked or whatever." The cracking sound has absolutely or very, very little to do with what's going on with that particular treatment. It's a byproduct of movement, like that in my knuckles there. It's a byproduct of me doing that movement. It just happens to pop, and people associate that pop with getting better. So sometimes I'll be training someone and they'll get their pop and they go, "Oh yeah, that's it. That sorted it out." And I'm like, I'm like, "Well, has it?" But their belief is that if it pops, it's some kind of magical, I don't know, magical, sound that says, "Now I'm gonna be feeling loads better." They do feel better because 'cause they're moving more. All we're doing as physios, osteos, and chiros is just facilitating movement. The better the movement, the less pain you'll be in, and the more likely you are to heal quicker. That's all it is. But that audible pop, "Oh, yes, that's it." And they get off the table almost like, I've laid a Billy Graham hand on their head, and they go, "Oh, yes, the spirit is in me." Uh, well, really, it's their belief of that little pop. So, yes, when they come in and someone's listened to them, and that's the big thing, someone's listened to them and listened to their problem and listened to their issues and spent time with them and cosseting them and even possibly, dare I say it, the sort of hands-on feeling or touch that they are being listened to and cosseted. It's that kind of feeling when they leave, that kind of experience that they've had, that then puts them on the right road to recovery.
I guess here with the ability to take action is knowing that belief. That's what's going to support us. And this comes back to what you were saying right at the beginning when you're describing what you do around that psychotherapy should be part of what you do. Still real, it's there. And our brain is doing things, it's trying to protect us. So it's trying to let us know, hang on, you need to pause, you need to stop what you're doing because this isn't right. There's something wrong. Now, is the thing that's wrong that you pulled a muscle, or is the thing that's wrong your environment that's causing a lot of stress and inflammation that is making your muscle hurt? So again, it's that we're a full complex being and we're all individual, and it isn't just that one diagnosis either.
Absolutely. But if you talk about, so if we go back to the military thing again, so if you're in a war zone, okay, and you're in pain and in a lot of pain, and it's documented, your legs blown off or part of your legs blown out or whatever. But the environment itself is so hectic, and there's so much white noise out there of gunfire, of the explosions, of people yelling and screaming. You don't actually feel that pain because your brain is set to dealing with all, like you said, the environment. And there's some elements of that that's important, I think. I think a lot of people, again, and what I see that kind of effect, that similar effect happening in majorly and mostly in women and mothers. So they'll come in and they won't have seen anybody for 10 years. And I'll be talking to them about it, and then they'll be telling me about all the people that they look after in their life, and all the things that they do for looking after these people in their life. And then I'll say to them, "And what about you?" They go, "Oh, I don't matter."
Ooh, yeah.
Yeah, exactly. I don't matter. As long as they're doing as long as they're okay, then I'm all right. But they're not.
There was an interview with Gabor Mate, who's one of the lead psychologists on childhood and trauma. And the research shows that predominantly the people with autoimmune conditions are women, and not because it's the SYXX chromosome that's impacting it. It's because culturally, that exact thing that you described, the mindset of a woman is put others first, look after other people's emotional needs, support other people, no such thing as self, don't show healthy anger. And all of those aspects are what suppresses within us. And that can be the catalyst for these autoimmune diseases.
It's interesting. Yeah, yeah, very possibly. Yeah. But again, it's research. You primed it with research shows, and the moment you say, for me, my mindset is the moment someone says research shows, I kind of switch off a little bit. Only, only because I just don't think we're quite there yet.
My take is slightly different with research is read it or hear about it, acknowledge it, and then decide, is this relevant to me? Could this be a reason that I'm suffering? And then notice. Don't necessarily have to act immediately. Notice what's going on for you, going on around you, and decide. And you can either reject it or accept it.
But is that cherry picking, all right, or is that cognitive dissonance? So when then people say to you, "This is it. This is how we do this," with knees, for example, 20 years ago, if I assessed a knee and I thought, "Oh, there's a meniscal problem," it was straight in to see the surgeon, chop it out, or fix it, or whatever, rehab, back you go. Now, completely different approach. Now, surgery is the last option. Okay, the first option's rehab. Your menisci can get better. Yeah, we used to think they didn't have a blood supply. The surrounding tissue has blood supply, but now we're thinking, okay, we didn't have the equipment to measure the blood flow through the meniscus. Now we do, and now things are changing. You know, and we're saying, okay, you can get better, and it can take maybe okay, we're talking 9 months, but it can get better. So don't poo poo your knee just yet, because uh, what we know now, in a 20 years time, particularly the way we're going at the moment, in 20 years time will be completely different.
I completely agree. And actually, it was just timing and the way that things happened that I didn't get knee surgery in the end. Did a scrape on the inside, and then I went to see the physios. I saw them for a session because I thought they're just going to give me the exercises that I can start working on whilst I wait for my appointment on the NHS. I'm going to spend the money on that. And their response was, "Oh, it's just your core." And then by the time it's your core stability, and that's why you can't do it. So I was just lumped into this idea, and I thought, I believe this. And because I didn't believe it, I then pushed for new diagnosis, new idea, because I wanted to help myself. And I think that makes a difference. What they then decided, oh, you need surgery. We need to repin where your kneecap is. As it happens, my file at some point got lost in the system. I'm still waiting for that appointment. That was about 7 years ago. But in the interim, I heard a podcast around recoaching your belief on pain. Now, I'm not saying that people aren't in pain because we are registering it as pain. But if we can coach ourselves to feel safe, there's a difference. And around the same time, I also had a conversation with somebody who works with Exeter Chiefs rugby players and said most of them don't actually have their ACL or the ligaments in their knee. But because of the musculature around it, it completely supports the function of the knee. So with those two pieces of information, it gave me belief. And so I started no weight doing squats. And when I felt pain, I just decided, are you sure that's pain? Is that really there? Is that really pain? And I recoached myself. And now I do exercises, which includes bends at the knee. That's fine. There clearly is still a problem because when I go skiing, my whole knee blows up like a balloon because it swells and it's trying to protect itself. But I choose something I find great enjoyment over what might be pain.
And that's good, and that's because you're driven, okay? And that's you, and that's probably why you did so well in the military, because that is a military thing. Before physios, or osteos or whatever, who was there? There was nowhere for people to go. So people put up with their pain, people put up with their rough lives, and they got on with it, okay? And that's very similar to the military, um, mindset. You know, when you go on for basic training, they chuck you out. So, right, do this, do that, do things every day that you don't wanna do. People don't have that resilience that you've got, and you have to work through that. Just like any kind of training, you feel soreness and pain. You have to be prepared for that pain, okay? And there is a difference between something that's a little bit painful that you haven't done for a very long time because you've been injured, and actual pain. And they can't differentiate between those, because the moment they get a bit of pain, they turn off. They go, "Oh, no, I can't do that."
I think this idea of resilience that you're speaking about is so interesting and might just be the key to everything that we've discussed today that supports us through that grief, that belief, and then on to achieve. And that achieve is taking action. Thank you so much for sharing your time with me today. And I can't wait for us to have another conversation. Those aspects that you found useful, share them. Share them with friends or family. Share this episode. Use it to support yourself and those in your life around taking action to live love. Please do me the small favor of taking the time to follow or subscribe, because that supports me in building this podcast. And I truly appreciate it. Thank you so much. I look forward to being with you here again in just a couple of weeks. And just a reminder, this is me and my experience from being a teacher in the military, working for a top university, and now globally on leadership programs and executive coaching. It's my experience and my experience of life. I am not a trained therapist. If you think you need professional advice, please seek a professional. Thank you so much for joining me, and I'll see you soon.